Let's now hear it from health experts. So we have with us Dr. Benjamin Campomanes. He is the Executive Vice President and Chief Medical Officer of St. Luke's Medical Center. Dr. Campomanes, good morning. Thank you for being here. Okay, let's get right to it, Doctor. What do you think of this policy to make mask wearing indoors voluntary?
Good
Or
morning, everyone.
voluntary, rather.
Yeah, so I think I look at it with a bit of trepidation. Let's just look at what we know now. No, the first is face mask really effectively filters out COVID virus. That's a known fact. Second, we are still in a pandemic. Remember that we are not out of the pandemic. So we have. We need to vaccinate about 70% of our population at least to develop some kind of herd immunity. We have only, I think WHO has announced that we have only vaccinated 63 million Filipinos. And if we're a 110 million population, we need at least 77 million to be vaccinated. So we have about 2.4 million Filipinos who are not even vaccinated yet. So looking at those facts, scientific facts, as I said earlier, with trepidation, I will about this decision to make wearing of masks indoors optional is something that we should think about.
All right, what do you think this means, considering that, we have the new variants here in the country? If mask wearing becomes optional, do you think we're going to see an uptick in cases?
It depends. This virus is, you can see how often the variants change. So that could be a game changer. If we get a really bad variant, now it's all right. But also, I was reading into CDC. They made a study of people wearing a mask and how it lowered the odds of testing positive. And they found out that this is indoors. So if you wear a cloth mask, 56% lower odds of getting the virus. If you're wearing a surgical mask, you have a 66% lower odds of getting the virus. And if you're wearing a N95, you had 83% lower odds of getting the virus. So this has been tested with, I think, about close to 600 people. So this is the newest study on that one. So really, wearing masks lowers the odds of you getting the virus itself.
Right, that is
But one
very
thing
significant.
very nice about Filipinos is even if we have the option of wearing it outside, I look at people outside; they're still wearing masks. So I think that's a good thing.
Right, we should remember that people can still wear their masks. Nobody's going to stop you from wearing it, right? But from your end, doctor, are you seeing more cases and more hospitalizations because of COVID?
No, our COVID ward has stayed steady. We are admitting about 15 to 20 people in our wards, and it has really not changed. And as of now, we don't have critical. We only have mild and moderate patients, mild with comorbidities and moderate patients in our wards. So that is a good sign that the vaccines really work. They prevent hospitalization.
Doctor, talk to us about your healthcare workers. How are they? Have they been getting sick? Have they been catching COVID?
Once in a while, we get symptomatic cases and asymptomatic cases too, because sometimes we do have random tests to test our workers, and we get some numbers because they're complaining of very mild very mild symptoms, and we do take measures that we don't get these numbers. And the hospital is really the safest place to be, because then it's mandatory in the hospital to wear masks.
That's right. Doctor, thank you so much for your time. We appreciate it. That was Dr. Benjamin Campomanes, Executive Vice President and Chief Medical Officer of St. Luke's Medical Center.